night.
Well, how are you?
I am well. I can't wait for today's conversation.
Mhm.
What do you want to talk about today?
Um, I think a good topic for today is maybe diving in a little bit on the actual process around death and dying, and physically and spiritually, if you're okay with that. I think it's the question that people allude to the most for me, but don't ask outright. It's the scary part for a lot of people. So, I think even just starting with that, right? Like as someone who doesn't do this clinically, um, what do you think of that topic?
I love that because I've got some questions for you
Okay.
for that. And I would love to talk about what happens after, because those are the questions that I get asked most
Mhm.
often.
Yeah.
How's my loved one doing? Can they send me a message? Did they make it over okay? Or is there even something afterwards? What does
Right.
it look like? But even the process of the transition from physical being to energetic being and what happens during that phase.
Mhm.
Um, when you don't know, you don't know. It's different for everyone. So I'd love to chat about that afterwards. But I think right now, one, there are the experiences that I've had, and then just people around me and
Mhm.
what they've gone through, those who passed away, and those who are in the process of
Mhm.
passing away. I think the biggest thing is fear around, well, what does it feel like? No one wants to be in pain, but obviously we don't experience death physically every day. So we don't know what to expect.
The
And so we
assumption
talk
is that
about
it's
fear.
hurtful, right, and scary. Mhm.
Exactly. So can you talk about, I mean,
Yeah.
every death is different. Clearly, you and I are still very much alive and we haven't experienced death, but based on your clinical expertise, what have
Yeah.
you seen? What have you heard through your professional experience? What is death dying like?
Right. And I think we've touched on this in a previous conversation as far as, asking the question to people who are facing their own mortality. It's something that I ask often is, do you feel like you're afraid of being dead? Or do you feel like you're afraid of dying? Because those are two separate things, right? And that's generally a more appropriate question for someone whose life is ending in death, right? Where when you're asking that question of someone who is in their 80s or has had a long condition that has just run its course and the body is obviously done. The answer that I don't think I've ever gotten anything other than I'm not afraid to be dead, I'm afraid to die. And and I know now that we've said this before because I remember saying, like, anyone who says they're not afraid to die, I don't believe them. Because, like, I've seen the process personally hundreds and hundreds of times, and I'm afraid of it, right? Like, just because of the unknown. I like to know what's next. I am a little bit of a control freak, as I think most people are, where it's like, tell me exactly what I'm about to deal with, and then I won't worry about it. And it's one thing that universally no one can who's done it fully. There's people who have almost done it or done it and come back, but nobody who's fully completed the process who we can say, how'd that go? You know? But I think, it's important to say that death isn't a moment. And especially when you're talking about like somebody or anybody who doesn't have a sudden event. So whether you're in your 40s or your 80s, if something is slowly leading to your death, then your death isn't that one moment. It's a process for your whole body. And until you've clinically kind of seen it from a healthcare point of view, I think one of the most shocking things for me when I switched from hospital environment to death and dying was how much your body will go through to not die. Like how hard it is to die. All these things they come into the hospital and you're like, oh my God, they're gonna die. And then you see them in their living room and they have those same things and very much don't die for like 6 months. And you're like, it turns out I don't know anything. It's a very humbling switch, right? But if you're talking about somebody who's toward the end of their life and their process is ending, That's where we'll start, I think, for feeling wise, right? And there's a ton of medical jargon around this, right? Like and death and dying jargon. And it's not bad in any way, but I think it's also very accessible. So I'm not going to say, well, you transition here and then this is your active phase and blah 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 blah. What I will say is there are phases of it, and it's a months long process for people who are going through a life ending ordeal, but not a traumatic event. A traumatic event is a completely different kind of death. But when you have that, just like I'm dying and then I need to die and then I will be dead, right? Like when you talk about that with people who do death and dying, they're like, first you're transitioning to death and then you're this, and which I don't disagree with. And I actually think is super, super useful. But it makes it feel very much out of touch, I think, for a lot of people who are like, it's not happening to me, but I'm afraid for me because I know it will. And now I'm watching it. So keep it simple. And I think that's the biggest thing to understand is I get a lot of times for the people surrounding the person when they're toward end of life, it's a much more difficult process than for the person who's going through it. The person who's going through the death is going through something they're supposed to go through. Your body is conditioned for it, right? Like your body is doing a natural process. It's the same as when someone gets pregnant and creates a life and then expels the life. That doesn't seem right, but gives birth. That
Birth to the life,
feels a
yes.
little fuzzier, but like gives birth. That's a process, right? And but nobody comes into it and like, oh my God, what are you gonna do? I mean, you do a little bit, but the thing about it is your body does the work. It's
Mhm.
not like you have to mentally work yourself through creating that life. Same version happens in death, right? Where like you don't have to mentally take the steps. The steps are going. You're along for the ride. And so the person, particularly the older person who's at their end of life, tends to be doing much better in that moment physically and mentally than the people who love them when they're surrounded by people who love them or people who care for them. And the reason for that is fear on both sides. Usually, something that I'll say to people is the mistakes we make in this moment are out of love for each other. So we don't say the hard things, we don't ask the hard questions, and we say we're fine on both sides
Mhm.
because we don't want the other person to worry, right? So if it's a mom and a daughter, right, and the mom is dying, the mom's going to say I'm fine, the daughter's going to say I'm fine, and they're neither one of them is fine, right? Like, whether that's physically or mentally or just anxiety wise, like it's a big deal.
Mhm.
So physically, what happens is it can start months ahead of time, 3 months, 6 months. I think that's pretty individual and it's very nuanced, right? But what you see first in people is a withdrawn, right? Like it's literally like, I'm sure there's a different perspective from a soul perspective, but the person themselves, there's so many pieces of you that need to die, right? There's your heart and your lungs and your bladder and blah, blah, blah. But there's also your consciousness that needs to die. And it's not a light switch. It takes time and it will slowly start to go through that process. And what tends to start at that point, and retrospect is always, that hindsight is really easy in that, is the malnutrition and dehydration starts months ahead of time. Your body's physically and mentally prepping itself to die, right? So that's when everyone's like, well, she's not eating lunch anymore. She didn't eat this, or, she only took 2 bites and they're going to starve to death. Oh my God, they're going to starve to death, right? And it's like, actually, part of this natural process is your body starts to say, I don't need to store up for winter. I'm not collecting to survive. I'm depleting to die intentionally, but not outwardly. It's not like their brain is saying, I'm going to die in 6 months, so I'm not going to eat that turkey sandwich. The drive for it stops. And I think
Mhm.
that's what makes it so nuanced for people. And the pain, discomfort, anxiety in that phase of death and dying is mostly mental, right? Because the person's not eating and drinking because they're not hungry or thirsty. So that's not uncomfortable, right? It's uncomfortable for the people who are supporting and watching.
Yep.
It's not uncomfortable for them. They're not eating because they're not hungry. That happens with old age, right? I mean, you could be very not dying and just 80 and not hungry. Most of the people, that's a common question I ask too of people who aren't even dying is, do you eat because you're hungry or do you eat because you feel like you ought to? It's a very interesting question to ask your elderly people that you love if you want to start a loaded conversation. Because the answer is almost always, I can't remember the last time I was hungry. Right. And so the conversation, but I know I need to eat my 3 meals a day. So I eat breakfast, lunch, and dinner, and they're very proud of themselves, but they haven't been hungry in a year. I'm like, okay, what are we doing here? And what I often tell people, and this is not good medical advice if you're not at end of life, but if it's end of life advice where it's that I always say, what would it look like if you waited to be hungry, thought of something that tasted good, and then ate? If you didn't eat breakfast, and this happens naturally to people too, like, we only eat breakfast and dinner. We don't eat lunch anymore, whatever. But what if you waited until you were hungry? Then you ate what sounded good instead of I better have my fiber and my fruit and blah, 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 blah. What if you waited till you were hungry and what you wanted to eat at that moment was a hamburger from McDonald's and you ate it?
Mhm.
And it tasted good and you felt good for while you were eating it, at least. When I've seen in people is they tend to eat more calories that way and actually do better nutritionally, for whatever version of nutrition that is, than they do when I'm forcing myself to eat 3 squares a day, but I can only stomach 200 calories because I'm not hungry. And then it sits like a rock in my stomach because my body wasn't asking for it.
Mhm.
So the next time I go to eat, it's even worse. But I power through and I got my clean plate club. And, so that's a really tricky phase of death and dying, but it's not painful. But all the red bells and alarms go off for yourself and for your family when it starts. Then as that progresses, depending on disease, right? The thing that I'll use is probably cancer is one that stands apart from like your normal heart disease, lung disease, dementia, Alzheimer's. Cancer stands apart in that whether you're old or young with cancer, eating is tricky because cancer takes first, right? There's lots of treatment for cancer, but the best treatment for it is one that we can't use, and that is malnutrition, because cancer is a rapidly reproducing cells and for most of it. And the first thing that is going to take from whatever you put in your body is cancer. So it wins, and then whatever is the leftover or your body can get for the rest of your body to stay alive is what you get. So there's a double-edged sword to I gotta eat, gotta eat, gotta eat, and I also have cancer. Because what will happen is when people stop eating unless they're hungry, cancer will slow in some cases. I don't have, we don't take CT scans and prove that, but you can see this improvement of people where, it just doesn't have but that's not a sustainable thing you can do of just starve the cancer, right? But when it does start to happen, you get a little bit of a honeymoon of like, I feel better because it's not growing at the pace, not able to keep the pace, and the pain can sometimes be better. So that's just a differentiator between the two, but you're still depleting your body either way. You go through that with cancer, you go through with Alzheimer's, heart disease, lung disease. There's this months-long process of depleting your stores because that body is going to try to live just physiologically. And then the next phase of it is kind of a limbo area where I tend to see a catalyst of death, right? And when I call a catalyst, it's either a traumatic event like a fall, an injury, you have a broken hip or something, or even just a fall without a massive injury that's noted, but you fell and your body's like, oh, we have to recover from this now. And it's just, gas you don't have in the tank. Or an infection, or you stop eating and drinking altogether, where either the body won't take it or the body can't take it, right? You lose that. In Alzheimer's, this happens where you lose the ability to swallow. You can't eat, you can't drink. Those are death catalysts. So one of those things comes along, and that can still be weeks ahead of when the actual death happens. But the process, here we go, right? Where the other thing you can go for months taking minimal calories. When you go into weeks, you've gotten a catalyst involved, in my experience, for the most part. And it depends on what it is, how the pain looks, right? If it's I broke my hip, then that hurts differently than I quit eating and drinking. I got pneumonia or I got a UTI is different than I broke my hip or I quit eating and drinking. But those are the most common ones. There's 100 million other ways this could come about, but those are probably the three that I would say are the most common. A fall with an injury, an infection of some sort, or you've stopped eating and drinking completely. those things will start to process, right? That's the part where that's the scary part. You're like, "Oh my god, it's happening." But it can still go on for weeks, right? That's the tends to be the part where people are like, "I'm here." And they go and they're like, "But you're still alive, and I thought I was coming to your deathbed," you know? And it's like very anticlimactic. And during this whole process, the soul and the person themselves is like withdrawing even further. So the people who are taking care of them feel this push to the front of making decisions, which no one is qualified for. And it feels very much like life and death, even though, and it's amazing the amount that people will forget of like, if I say no more, if I say it's okay not to give them their blood pressure medicine anymore, then I'm killing them. Forget that they're 85 and have cancer. If they don't take their metropolol today, then I was why they died, right? Like it just, but you get put in a situation that no one should get put into. And we have so many ways to intervene physically for people, right? Or we can maintain your body. We could, let's do some tests, let's take some x-rays, let's blah, 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 blah. But the process has begun, right? And in my experience, I've seen people go into the hospital, stay home. Either way, the timeline is the timeline, right? You can't force it forward, and you can't push it back, right? You can force it forward. You can't force it forward legally, right? Or morally. But if you're just along for the ride, the timeline is the timeline. So how are you going to spend that time, right? If you already know you have something that's going to take you, is it worthwhile to spend your time in the doctor's office, in the emergency room? Let's hydrate. Let's do this. Let's do this. That's a big thing that happens all the time. Well, they're not eating and drinking. Let's give them some fluids. Okay, cool. Now their body has to try harder to dehydrate again because they're not taking it in. So you've just given yourself a weird plug to pull again. I can hydrate them. When do I tell myself to stop? When the decision was already made for me before I intervened. So there's the mental pain of that this is still in that space of where like, it's not uncomfortable yet, short of having a major injury. It's mentally uncomfortable. Then essentially what happens is as you withdraw further and further, you become bedbound for most folks, where they're no longer waking up, they're not getting out of bed, they're not participating in the things they used to participate in. And then the discomfort of that, especially if we're talking about an older person, is this is an 85-year-old who hasn't been out of bed in 3 days. I'm 43. If I don't get out of bed for 3 days, I'm going to be sore. I'm going to be stiff. I'm going to be weak. I'm going to feel terrible. And so are they. Like, so it's kind of, in my experience, the normal pain of being stuck in bed, more so than the pain of dying, right? The pain of dying is just systems slowly shutting down. But if you get in bed and you're not getting out, and you're at a certain age, there's pain that's associated with that. So my teaching is always to say, please don't make the dying person prove that it's uncomfortable physically, right? Like we can make this assumption. So all of the rest of medicine is, if it hurts, let me know, we'll take care of it. Dying in medicine, in my opinion, is, and my experience should be, let's assume that being stuck in bed at 85 for days on end, or 75 or 95, whatever, is uncomfortable. And let's treat for a baseline level of that pain. Do you need 100 milligrams of morphine because you're sore or stiff? No. Do I need to wait for you to give me a sign that it's uncomfortable so that I feel good giving you medicine? And no, right? Don't make the dying person prove it hurts. Don't make them prove it's uncomfortable. Let's make some assumptions, right? Like, and give them just basic levels of continual, what I want is that straight line of comfort, right? A lot of what I see when I see people who are dying uncomfortably is like, my back hurts, right? I haven't been able to move my own leg in 3 days and no one has moved it for me. That's the pain of dying. And I think we all think it's this big, magical, cataclysmic, like every cell is pew, pew, pew. And I've never seen that. I've never seen anything where it was a normal process of dying. And I walked in and I was like, what is physically happening here? Oh my God, that I couldn't tack to like, wait a minute. This 85-year-old's been in bed for 3 days. No one's rolled her on her side. And no one's given any medicine because she hasn't said anything because she's no longer capable of speech, right? And then that for me is the thing of like, let's make some assumptions. Let's aim for them not having to tell us, because as their soul withdraws, I'm asking so much of them to be able to say something. So when someone is bedbound for me in hospice, I will tell people and families that are taking care of their loved ones, like, this to me, if you are bedbound and you're not opening your eyes on a regular basis, is the equivalent of standing on a chair and screaming in pain, because you had to come back out of that sedated, not sedated isn't the right word, but that withdrawn state that comes with death, to force your body to show a sign. So if they're just restless in the bed and they're uncomfortable and it's small movements, right? Like what they should be is this peaceful, serene look of just, because anything they're showing to show you pain took such a monumental amount of effort to overcome the withdrawal state of dying. Does that make sense?
Yes,
So what I
completely.
tell people all the time is, please don't make this dying person prove that being in bed is uncomfortable, because it is. So just give them this small dose. And usually it is morphine, which freaks people out. They're like, morphine, I'm going to kill them. Not unless you're trying, right? Like, not unless you're trying. And that's why you bring in professionals who say, give them this much. And don't make the dying person prove it hurts, because it doesn't have to. If we treat that physical pain of being in bed, I've seen more than, I would say, the vast majority of people who die an expected end of life death can and are completely out of physical pain if you keep them on a schedule of just the bare minimum and it's given regularly. What will happen when we kind of switch over into what people will call active dying, when it's like, here we go, right? Like you see changing in their breathing patterns, you see all types of things. I think one thing people fear who've heard of deaths before or have been around it are like that they're going to death rattle. I don't know if you've ever heard that term before. Like they're going to death rattle and it's going to be terrible. And I hate that term so much. and it's not a necessary thing. And it's also one of the things that we have so much research on, whether or not it hurts. Does it hurt to death rattle? And the overwhelming evidence is no, it doesn't hurt. It's literally your body is so relaxed and so far back, and sometimes there's fluid involved, but you can't do can't swallow anymore. Can you do that anymore? No. So you get the in your throat. And if your body hasn't been allowed to dehydrate as you go through this process, if you've had somebody sitting there lovingly giving you water you didn't ask for the 3 weeks leading up to that, you're going to rattle because you have fluid your body didn't ask for coming into that process, and it doesn't know what to do with it. So like there's nobody who dies more peacefully than someone whose family has accepted, I'll give them what they ask for. Nothing will ever be withheld from them. I'll offer, and if they don't take it, they don't take it. And when they get good and dehydrated is how I think of it. That death is so smooth and pretty, and with almost nothing, because we didn't try to make it better with the things we think make life better, right? Just take one bite, just take a few sips. And that is so based in love. And the person taking it usually is also, I don't want my daughter to worry, even though the last thing I want on this planet is another freaking sip of water. So I'm going to take it instead of just saying out loud, it's okay. Go away with the water. And if I'm thirsty, I promise you'll be the first one to know, right? And when you can get to that end process and you are good and dehydrated, what literally happens is your system shut down one at a time, right? And it doesn't need, and generally in my experience, only the pain of immobility is what's present, right? And so if we're talking just from a pain standpoint, so if the immobility pain is well covered and cared for, and the person is good and dehydrated, what happens is literally like your systems will shut down one at a time. Your body will immediately focus on your head, heart, and lungs. So your GI tract's going to stop, right? Like they'll stop pooping. They're not seeing those things. And that's good. That's why they're not hungry, right? Like nothing is pulling through. So they're not sitting there thinking, oh my God, it's been 4 days and she hasn't taken a bite of food. As a nurse, I put my stethoscope on and I listen. I'm like, that stomach is not moving anymore. And movement in your stomach is what makes you hungry. So she's not hungry laying in that bed. And if you put food in there, nothing's moving. So you're just putting a cement brick at their stomach while they're going through this that they didn't ask for, right? But out of love, we're like, "Oh, she got a bite today. We did it." And it's just a process. But when they're good and dehydrated and their bed-bound part is taken care of without making them prove it hurts, don't wait for that, "Oh, yeah, now it hurts. I can feel good giving them morphine." Think it through. You hadn't moved in 4 days. Would you want a Tylenol? Would you want an ibuprofen? Would you want an Oxy maybe? Yeah, you probably would. But if you couldn't ask for it, you're gonna need someone else to assume. Um, then that last little bit, right? So good and dehydrated, as they shut down, like your lungs will do, lungs and heart will kind of do like a little back and forth. Like the heart starting because you do get dehydrated and the blood slows down, all those things. But what you see outwardly from people is the breathing, right? Like they'll get, it's called apnea. So they'll be like, oh, they stopped breathing. And then everybody sits around their bed and gets really close and stares at them like this. And it's like, oh, it stopped for 26 seconds and then it started again. And they went, "Ooh," and took a deep breath. And now they're breathing really fast for a little bit and then they go back, right? And it's like, okay, couple of things. Does that hurt, right? And I think it's mostly based in where is your brain, right? Is your brain still present the way my brain is present and hopefully yours is right now, right? You're like, oh my God, I'm not breathing. Usually in this instance, days, if not weeks ago, is when the person last interacted personally because their brain has withdrawn so fully from their body that you haven't interacted. And that's the blessing of death, where you're not like, oh my God, I'm not breathing. Your body is just stopping, right? So, physically, through that process, even when the heart kind of, if you feel or listen to hearts or feel pulses as that process is going on, is the heart kind of all over the map? Yeah. You get different rhythms, you get different things. But I've certainly had full conversations with people in the hospital and their heart's all over the map and they have no idea because they can't feel it, right? Because they're not having a heart attack, their rhythm is going crazy, right? They may feel that flutter if they were a fully conscious adult human, but are they feeling it right now? And have I already, if there were some pain associated with it, I've already covered pain. I'm not asking them to prove to me that there's pain. And there's no circumstance in which I would say, and this happens all the time, and I was guilty of it when I first started doing it, of like, they're dying. Let me see if they still need this medicine. Which was, I feel you got to learn somewhere. But I'm like, oh man, how many times did I make someone prove that they were really dying, right? Before I just kept medicating because it's scary, and you need an expert to, you don't want to overdo it. You don't want to be the reason something happened, and you don't ever want to lose track of the reason you're in that room is cancer. The reason you're in that room is heart disease. The reason you're in that room is your lung disease, whatever it is. The reason you're in that room is not whether or not you give the next dose of the medicine the doctor said was okay. You know? But honestly, the best death is those apneic periods. They stretch out, they stretch out, they get a little longer, and then at one point you just don't pick back up again. And it's as anticlimactic as you could ever imagine. More than one time, I have had to sit there as the nurse in the room and be like, well, they just died. And no one else knows this but me, because we've been used to watching this apnea happen for days. And, there's, for me too, it's like, well, I'm going to sit here for a hot, good 5 minutes before I believe that's what just happened, but I'm pretty sure that's just what happened. And that's how peaceful death can be when we get out of the way.
Mhm.
And that's physically, right? Like there's the mental piece of it and the, as we talked about assholes die too kind of piece of it. When I say assholes die too, I say it one because it's funny. And it's a little bit of that shocking, like, hey, you can't call an old person or a dying person an asshole. I'm like, I think I disagree. But there's beautiful people all across the map, and I'm guilty of being both on any given day. What I mean by that is like there's the spiritual and physical bringing in of your anxiety onto death. So pain and anxiety work together during death because physiologically your cells are on hot red alert. Your body will throw the kitchen sink at dying. Maybe if I get a fever, I won't die. It'll give you, the person dying will get 105-degree fever. You're like, what the hell? But the body's like, what do I do? Physiologically, it's that feeling if you've ever had high blood pressure before you treated it or something like that, and you just anxiety, or you have something, and it's that if you say anxiety to a certain generation, they're like, I'm not anxious, I'm not crazy, I don't, and like So you really have to say, no, what I mean is your cells are panicking and we need to calm that down. And that happens whether you're an anxious person or not, the
Mhm.
cellular piece. So for me, I will always say morphine is for your body, and Ativan or lorazepam, which is an anti-anxiety benzo, is for your mind and to calm. So you want both. Whether you don't want to make them prove either one, because both are going to be part of every process I've ever seen,
Mhm.
every time. Not in massive doses. Not, I mean, I think people think hospice comes in or the nurse comes in and there's everything I got until you die. No, everything I'm giving you, people go out and take every day and go to work. Like I'm just giving you it on a schedule to make sure that this is as comfortable as it can be, you know. So the process itself can be it's anticlimactic as all get out. When you treat just what you can see, it's not supposed to hurt, right? You're supposed to be doing it, right? Your body is letting it go.
Mhm.
If you stay ahead of what we can take care of now, then it can be so anticlimactic that it's a little shocking for people who are like, that wasn't so bad. And then everything else that does happen. What if I did give my person water for the last 3 weeks and now they do have that gurgle? Are they uncomfortable or are you? Right? If they're sitting there rattling and they look peaceful and serene and their people around them are like, oh my god, oh my god, oh my god, like, well, that person doesn't need Ativan but her daughter does. Like, because it's scary, right? So let's talk about, does it hurt? Does it look like it hurts? It doesn't hurt. Can we roll them over maybe a little and help alleviate where that's sitting, and all those things that we can do. um but it's that piece, right, where the process is so simple for the most part, right? And that's simplifying it down to these expected end of life process deaths. The process is anything but simple, but you know what I mean? When you break it down into what can I control and what can't I control?
Mhm.
What's happening and what do I want done for me? And when it's that way, it's very much so. I mean, I'm taking care of the fact that you've been stuck in bed, not that necessarily that you're dying. And it helps when the bigger things come along of death because it just basically hedges my bets, right? That I can assume that some pain is going to come, so I'm going to stay ahead of it on a schedule. Not in a massive way, not in a way that will kill you or even sedate you. A lot of times people think, well, they don't talk anymore because they're on morphine. I'm like, they weren't talking before we started that. And the not talking is part of the process of withdrawing. I think that the other mistake that I see, and then I'll let you ask some questions. I know I've kind of,
Keep going, keep going. I've got questions listed here.
but like the biggest mistake I see people make in this process, there's two. One is making the dying person prove it can be uncomfortable because let's assume it is. That's what I would want assumed for me, right? I don't need you to assume I need everything under the sun, but just in case me, yes, please, right? Like, and the other thing is this unmistakable drive to be there when they die for people, right? I mean, when you're dying, you're not able to communicate. A lot of times your mouth is hanging open. A lot of times you're drooling, you're definitely in bed. You're not who you normally are. You're withdrawing. And what I will say to people when I come in and there's 10 people around the bed and they're all talking and I look at the person and they look like this, right? And I'll say, okay, what would your if your mom was your mom right now and you were all standing here talking and she wasn't able to tell you what she thinks or what to do or what she wants done, would she like this? Right? And you'll get 10 little eyes be like, oh God, she would hate what we're doing right now. Like she's right there. Like she's here and she hates it. I look at her face, and just clearing the room can bring that thank you, because people are still there and they can still hear. And
Mhm.
every time especially if you have someone, I think this will be me of like, I want to tell you what I think and I want to tell you what to do. And you're standing there, I'm going to fight against the process to be a part of that conversation. Or even if I just love you to pieces and I want to tell you that it's okay, I'm going to fight against that process if you're all around my bed.
Mhm.
Every now and then I find families that are like, oh, no, 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 no. She would love this. She would love to hear us talking. She would take a nap in the middle of the football party and just be great, right? Like, cool, stay in this room. She never
Mhm.
wanted to be alone, stay in this room. If I hear she's such a private person, she's always took such good care of her appearance. She was always protecting me from things.
Mhm.
Get out of that room. Right? Stop it. Know your person. And I can't tell you specifically how to do it because everybody needs something different. Right. But that's a mistake people make all the time. I can't not be here when she dies. And I really feel like it's that from my perspective, it always feels like they think they're being judged as far as, well, if you're not in that room when she dies, did you even love your mom? Right? Like, did you even care about this person? And so I do my best to say, this is a process. You were at every doctor's appointment. You came to every meeting. You administered all these medications. You opened your home. You moved into their home. You showed up every day for the last 6 months. And you think if you're not there when they take a last breath, somehow you weren't there. I will write you a note right now from a nurse that says, surrounded by loving family at time of death or during their death, throughout their death, right? Because it's not a moment. TV teaches us that death is a moment. Movies
Mhm.
teach us death is that plink, you're dead,
Yep.
right? And so if you miss it, you didn't care. And my experience of that is you can't miss it at all. And if you're supposed to be there, you'll be there. If you're not supposed to be there, good luck. It's private. I would not want my kids to see me go through the last little bit of death because it's private. It's the same as like, how many people would you like in your delivery room while you're in stirrups and for the world to see?
Mhm.
If you're somebody who's like, oh my God, I barely want my husband in there, then you don't want someone to come and watch this private process either. Does that mean go home and never take care of them again? No, it means go in, do the thing, say I love you, leave. Go in,
Mhm.
do the thing, say I love you, leave. you know, Give privacy and support. And I think this like bedside vigil is feels so like I'm proving my love for my mom. And like, if you're trying to cram for this test, you're late. You had your whole life to prove your love. And also she doesn't want you to sit here with the neighbor that she hasn't seen in 20 years that just came to visit and wants to know everything that's happened, who inside of your brain, your mom didn't even ever really like, and is now watching her mouth open in a bed.
Mhm.
Remember, your person is there till they're not. Those are the two big mistakes I think I see in an expected kind of path. The end.
That last part of what you just said, of having the neighbor they never liked, they
Mhm.
are watching this process and then wanting the juice around what's going on and how did it get to this point and all.
Looky Louism of death.
To my entire family who's watching this, I don't want any of that. It is a very private moment. I can say, and I've said this to my husband before, I'm like, he's the only one who absolutely has to be there.
Mhm.
And if he crosses over before I do, he's the one coming to get me. And part of this is, well, and my dad will show up. But for
Mhm.
him, every night as he's talking to me, his voice is so soothing and so comforting to me that I fall asleep instantly. It irritates the hell out of him because he's like, we need to talk. It's that he's my person and it's that comfort and
Yeah.
it's that I want that level of comfort as
Mhm.
I'm going. I don't want my children to see the process. I didn't want anyone present at my births.
Mhm.
That's
Yeah.
such a private moment. And I know some people are like, I want my mom and my sisters and my in-laws and everyone can be there. And let's throw a party behind the doctor as they're catching the little
My
football and
legs are in
going out.
stirrups. Hard pass.
I had a tough time with the doctors,
Mhm.
let alone everybody else. So no, this part is mine. That's
And
it.
moms are sneaky. They will protect their kids. If you're going to take a 2-minute break, she's going to get busy dying while you're leaving if you're one of those ones that insist on being there. Yeah.
And all the friends of mine who've lost parents and have
Mhm.
gone through that, yes,
Mhm.
what you just said, yes, that's what they went through.
Mhm.
Um, and everything that you said, Kate, thank you for describing this, because and taking the time to define each stage of this
Mhm.
process, because you're right, the media portrays this, or entertainment portrays this as a,
Yeah.
you're shot, you go. You've been dying for a while, you had cancer, and then they'll do like fast forward little scenes or whatever, and then all of a
Little
sudden it's the final
breath
breath.
while you talked 10 seconds before.
Yeah. But nobody knows. So that's what people assume
Mhm.
is the process. And I wanted to bring up, like, in each stage, there were certain things that you said. And in my experience, or my family's experience, I want to share some of these things. And for you to be able to say, that's not normal.
Mhm.
Or, you know what? Yes, in some cases that is. And wherever I'm saying things, obviously, that medically don't make sense, please obviously correct me, for all of the people who are watching and viewing.
Mhm. Yeah.
Um, but one of the things was around eating,
Mm.
and around watching the person, or allowing your loved one to eat or drink when they need to.
Mhm.
There's a component of that that exists in every aspect of life. And for me right now, going through my health issues, considering my age and whatnot, I have to eat
Mhm.
when my body asks for it.
Mhm.
So, to certain family members of mine who are like, you're always eating. Yes, I am, in very small doses, because my body wants it.
Mhm.
It doesn't mean it's going to last this way forever. And I only eat the things I crave. So it's
Mhm.
the things, and it's not fast food.
Mhm. Yeah.
Um,
It rarely is, right?
I can't. If I eat fast food now, I get incredibly sick. Like, it's not
Mm.
even
That
enjoyable
works.
while I'm eating it anymore. Um, but it's this, my body wants certain things.
Mhm.
Then I need to eat those certain things at the moment that I'm eating it. That's normal. And
Mhm.
everyone, I mean, regardless of that, to my kids watching, eat in balance and not overeat. Don't overconsume anything, because your body doesn't want it or doesn't truly need it.
Right.
But as you go through the dying process, just watching my family members
Mhm.
slowly start to cut back after watching them for years. I'll say my dad,
Yeah.
because
Yeah.
my
It's great.
dad was a steak and
Leave it
potatoes man. He
be.
loved that with a couple glasses of wine. And if he could eat that every day,
Yeah, for
he
every
would.
meal. Mhm. Yeah.
And then towards the end, my mom was like, well, he needs to eat healthier. And she'd sneak in more vegetables or some fruits. He wasn't allowed to have sugar.
Ugh.
And slowly it got to the point where she got, I think it was for his birthday one year. She gave
Mhm.
him a strawberry.
Mhm.
Like, this was a big deal to
Yeah.
give him a strawberry. She found the biggest strawberry she could find. And that's what he had.
Mhm.
But he didn't want anything else. And then as he did crave certain things, she'd make whatever. Like, when she realized the death process, because she had seen death
Mhm.
in different stages throughout her life. So when
Mhm.
she saw him progress,
Mhm.
and he was like, I really want XYZ, she would just make it for him.
Mhm.
And I mean, he died happy. He died exactly. And we talked about this before, but
Mhm.
that's that was more of a sudden death, even though his
Mhm.
body was already progressing, going through all those stages.
Mhm.
But he wasn't in a coma for 3 weeks. His
I
mind
mean, most
wasn't
people
going.
don't need to be. Yeah.
Yeah,
Mhm.
it's
Yeah.
that was because just like everybody is different, everyone's death process will be different. But we're talking about certain physical or
Mhm.
physicalities of these stages for people to understand that this
Mhm.
might be what you experience.
Yeah.
Not everybody goes through it. But
Mhm.
one thing I wanted to say this out loud, because, and please correct me, the
Yeah.
one thing that my mom has said, and what she's noticed in people who were going through their stages of death,
Mhm.
towards the end, there was like a yellowing of skin, and she
Mhm.
would notice the lips would turn gray.
Mhm.
And inevitably, within a week or two, the loved ones would pass away. So
Mhm.
for her, every time she notices that or sees that, like, she'll call me and she'll tell me, they're at
Mhm.
the end, the
Mhm.
lips are gray.
Yeah.
Is that something that pops up with somebody, or is that tied to a particular type of disease potentially
Mm.
that shows up at the end?
So, yes and no,
Or is
right?
my
Like,
mom crazy?
yeah, no, no, I'm not saying that. Not on video, for God's sake.
That's to
No,
make
it
her laugh right now, so she'll yell at me later.
I had nothing to do with that. Uh, but, Yes and no, right? So full on yellowing of skin, and anybody who's ever seen somebody who goes through full liver failure, it really truly looks like they were colored in with a yellow highlighter. Like shocking jaundice from your liver, right? Um, is there's a change in pallor or like your skin tone. The way I describe it usually is more waxy, where and you can notice it generally in that phase between, they've stopped eating and drinking so much, and right at that catalyst moment. And you don't always know the catalyst is there, right? It could be a UTI you never heard about, could be a pneumonia we just aren't at the hospital to hear, could be, whatever it is. My heart all of a sudden is in an arrhythmia that I don't know about, and now things have changed. But I'm not dying right now, but the process is much more imminent than it was 6 months ago when I started dying. And then you get, and for me, what I'm thinking of is when I walk in and I think, oh boy, that's not your normal color. Is it always yellow? The yellow is very liver related for people, but when you kind of lose that glow of life almost, it can, whether it's fully yellow or she's like, or my assumption is she's seeing more of a yellow tint then, and what's really happening is you don't have as much blood flow, right? If you want to make it scientific, I would say your body has started to recognize you're in a different phase, and it's prioritizing your head, your heart, and your lungs. It's not
Mhm.
thinking about your gut. It's kind of like when I see that shift, I want to listen to their stomach because I want to see, is it slowing down too? This is a little validating to me that we've switched processes from this here we go to here we go. And that's about the time where you'll see, that getting into bed or just not getting out of bed as often, and less communication by a mile because the body's focused on living, not speaking. So yes, I would say there's definitely that moment. The lips being gray, same thing of like circulatory wise, like people will say, hands are cold, hands are waxy. They change kind of that look, which just, and you'll come in, and I see this all the time where like you come in and like one day their hand looks a certain way and they come in the next day and it looks so much more skeletal. And it's just your whole body um focusing in on that, the things that you need to live, which is not your fingertips and it's not your lips, it's not your glow of life, right? So um if somebody gets a massive injury out in the world, they'll kind of go into that shock where your body's like, nope, all of my blood is going to go to my heart, lungs, and brain. I don't give a crap about my pinky toes. It's like cold hands, cold, and that's why it's one of the reasons I tell people, and I wish I'd mentioned this earlier, so I'll mention it now, is never, if you're, and again, horrible medical advice if you're not just like, we know we're dying, we're not trying to do anything about it. But in my opinion, the right medical advice for we're dying, stop taking their vitals. Stop it. Because what will happen inevitably if you have lung stuff is they're going to put that on your finger that you've put on, and the person put on every 20 minutes their whole life of like, oh, I'm good. I'm 91. I'm 92. I'm blah, blah, blah. They put it on when that change happens and they're 52, but they're sitting there talking to you like they always are. And I'm like, are they really 52? Or does that read the blood that goes through your fingertip to tell you what your pulse ox is? And you have no blood in that finger right now. So they're cranking up oxygen that doesn't need to be cranked up, and they're panicking the person and themselves. Oh my God, here we go. Here's my evidence that we're dying today. And then that person lives for 2 more weeks, or, however much longer they're supposed to live. Maybe they are dying today. But the point of it is, if you're not planning to go to the hospital for that number, and we have made that change, stop it. Because you'll get people who sit there and like leave it on. No, it's 7, it was 72, now it's 71, now it's 69, now it's, what are you doing? Can we, if we could fix these lungs, we would have. Stop it. Take my blood pressure. Oh my God, my blood pressure is this over this. Am I going to start a new blood pressure medicine today? No, I'm not. So stop freaking yourself out with their vitals. So that's just an aside of that. But I would say, yes, absolutely. Kind of like, and that's what death used to be, right? Is people used to die in their homes and their families would notice when that change happened, and they'd get the look, and they'd, go lay in bed or go sit in a chair and never get up again. And family would take care of them, you know? So yes, I would say your mom is not crazy. The yellow, I think, is maybe more a personal note of what she thinks the color looks like, unless they're like fully jaundiced. Is more rare unless you have something that you know is liver related to get very yellow when you die.
Yeah, she's been a caretaker for seniors, and there's a
She,
progress that
yeah.
she notices certain things that are
Mhm,
happening. I want to say too, there was something that you said that really, really, really resonated with me. Don't make a dying person prove that it hurts.
mhm.
Thank you for saying that, because I mean, one, none of us want to be in pain when we're dying. I mean, if you do, there's something else, maybe see a
A whole
therapist,
different
but
episode if you do.
exactly. Don't
Yeah.
torture yourself. At least I don't
No.
want to be tortured
Yeah,
during
I
the
don't
death
wanna be your
process.
nurse
I
if that's
don't
what
want to
you
feel
do.
pain at
No,
all. And
nope.
if I can no longer vocalize it for
Mhm,
myself, please medicate me. Because you're
mhm,
right. Last night I was thinking about this as I was lying in bed. And due to one of the medications that I'm taking, my bones hurt regularly.
mhm.
So, and I know that this isn't my disease. It's literally a side effect of my medication.
Right.
But I was laying there on my side, then on my back, my legs were hurting. I kept moving and I was irritating myself because I'm like, you got to go to bed.
Mhm,
That was over a span of maybe 2 hours.
mhm.
If I'm in bed for 4 days, 2 weeks, 3 months, for the
Don't
love
just
of
give it to me
God.
during the day, give it to me around the clock, and
Exactly.
don't be shy. You know?
Exactly. Well, it's that. And then what I remembered as you were saying that was my grandmother. So
Mhm,
my grandfather died of cancer
mhm,
many, many years ago. This was back in 1989. My
mhm,
grandmother was a nurse's assistant.
mhm,
So she knew certain things of how to take care of him at home.
mhm,
And there was a nurse that would stop in and give him medication, but she would massage him. And
mhm.
after he passed, she would talk about like her kind of way of caring for him because he couldn't eat anymore, and she knew the process that he was going through and she saw it, but her thing was she had to massage him. It was her way of making sure that he was okay, so his legs, his arms, that was what she did. So as you were saying that, I'm like, there's certain things that family members, and we don't have to force feed someone who is physically saying, I'm not hungry,
Yeah.
stop giving me food.
Mhm,
But
and
they
that's such
might
a
not.
hard sentence to ask them to say, because it sounds like, "Let me die."
Well, I want to get to that too.
Mhm,
Suicide is one thing.
mhm,
The death process is another. And you saying in your death phase,
mm,
I'm okay.
mhm.
Let me go. That's not suicide.
Yeah, your Catholic is showing. Mhm.
I know I'm not the only one who's going to be watching this that's going to need to hear that, because like I've voiced this already, even in
Mhm,
my family. I'm like, when my time comes, just let me go. Don't give me more medication to sustain a life, or a body, I should say, to sustain a body that is going through the process that it needs to go through.
mhm,
Let
mm,
it go. I know emotionally that's hard, but that's why don't live a life of regrets.
right.
Take advantage of the fact that I'm here right now. Let's talk. Let's write things down. Let's record things.
Mhm.
Everyone dies.
Say the thing, eat the cake, take the vacation, but let me go.
Exactly. Oh, that's always been my mantra. Don't wait for X to
Mm-mm.
happen, because you might not hit that milestone
Mhm,
ever.
mhm,
Right? Enjoy your life every day that you have. But during that death process
mhm,
itself, like I don't want to feel hungry. This is the thing that came up. I think I watched something on TV or whatever, but like there was this moment of, I think it was someone in a coma who was not given food. And
mhm.
so they died of starvation.
Yeah.
I don't want to feel hungry
Mhm,
ever. But
mhm.
if I'm going through that death phase, I'm glad that you said that. Like the body is shutting itself down. It's going through its process of not craving things that it no longer needs.
Right.
So don't force feed me. I know that you want what's best for me. Thank you.
Mhm,
And for everyone who's watching too, like make sure you say this to your loved ones. Like, how do you want to die?
right.
How do you want to feel going through that process? Make sure everyone who's around you, friends or family,
Mhm,
knows.
right.
Document it if you need to, but have that ready. Also, tied to this, as you were talking about this, I have a family friend whose husband died a few years ago.
Mhm.
and he was incapable of eating, drinking, anything. He was absolutely 100% dehydrated,
Mhm.
only have ice chips, but he was not conscious anymore at the end.
Mhm.
And his wife was worried
Mhm.
about, this is horrible, because she was watching the process happen.
And putting it on who she felt like sitting in the room.
And
Oof.
she was worried that she couldn't do enough
Mhm.
because he was dehydrated, and she was giving him more, when the reality is the body was saying, no, 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 no. He doesn't
Mhm.
actually need this anymore. So she, for whatever guilt she's feeling if she watches this, you don't take it on yourself. You were doing
No.
what you thought was best, and his body was going through what it needed to go through, as horrible as it was to go
Well,
through that.
I think that's a really good point, right? Like, because I don't want anybody to hear this and think, oh my God, I did that. I gave this, I did this. You can't do this wrong. I think that's probably from the people who are doing this with their person, right? Like, when you show up to something, this is what my mom always told me about being a mom, which was actually, in retrospect, some of my favorite advice of like, it's so much about your intentions because you're going to screw it up, right? Like, about being a mom, it's like, you're not going to be perfect, but were you trying to be? Were you doing the best you could with the knowledge you had? Your intentions were good. You're going to miss the mark sometimes, right? Like, for me, I think it's very similar to death, where it's like, don't micromanage this and don't give yourself so much credit. Did 10 ice chips tip the scales one way or another, good or bad? Absolutely not. I've never seen that, ever. And if in the moment what you needed to do was give them a drink of water to just survive the moment you were in, then you did it right. And it's what they would have wanted you to do, because it's happening to you too. And in some cases, more so than it's happening to the person, because they're not aware, you are. So you're able to judge yourself and put things on yourself and I think this is the thing that I like. I'm always in awe of our ability to give ourselves credit for death, even though I'm like, why don't we all agree to blame cancer for that one? Let's blame cancer. Not whether or not we fed them this or that, whether or not we medicated here or there. The reason they died is not us. The reason they died is, and if we could fix things with food, right? Like, when you say this, we'll circle back to the recovering Catholic in both of us, which is that preciousness of life that is sometimes very religiously backed of, I don't want you or me to go to hell for what we're doing in this process. And it is so deeply held in people. And it is a line that no one gives any guidance on from any church that is helpful at all. And we all take away our own homework assignment from what that means, right? Like, you can't just give up. You're killing yourself. And to that I always say, like, again, let's blame cancer, right? Like, I'm not killed. Like, if I had my choice of this, I'm not saying on a Tuesday, let me die.
Mhm.
I'm saying if cancer gets to the end of this battle and has won, please don't stretch it out because of some deeply held belief that I don't share with you. Like,
Exactly.
and let's be clear that, you know, you can't pick and choose what is and isn't God's will or the universe's will or whatever, right? Like, if you're going to die of that and it could be changed by a turkey sandwich, you were never going to die of that, right? And if you could stop eating and have that be the reason that you die, right? If really truly you were like, my body won't let me take this in anymore, and then cancer took your life, did you die of not eating or did you die of cancer? Right. And who, like, for me, I very firmly believe like cancer happens because I don't think, I don't live in this space of God reached down and gave me cancer to teach me a lesson. Right. Because I, science wise, I think I know what happened. Your cells are doing it wrong. And now you have cancer.
Exactly.
Now, whether or not you turn to God for support in that moment and you feel favored or unfavored is based on your own beliefs. But the individualism of it, like there's 8 billion people on the planet, and to say you get this instead of your cells giving you that, and then the support system being your religion, it's hard for me to jive that. But when you Catholics in particular, and there's plenty of faiths that feel this way of like suicide is horrible and this and that, and um it's so, when you look at it, different. Even when I've had experiences with people who do medical aid in dying, where they do I have a terminal disease, they take the drink and they die.
Mhm.
Another episode. But you know, those would never have happened were it not for the thing that was killing them to begin with. And what you're doing actually, when I have experienced that, of people saying, and especially people in large Catholic families saying, I just had an experience with a patient not long ago who came from a very large Catholic family, and it was a younger person and had decided to stop dialysis because they were beginning to they were just done. And without dialysis, they would die. And that was preferable to what they were going through going. And they had the very staunchly Catholic mom who's like, you go to dialysis until you get hit by a bus, like, until it's like this confidence in that's not what you're supposed to die of, even though what we really did was 10 years ago, before that dialysis started, your body started to die. And we scientifically and medically intervened and said, nope, to what would be presumably God's will.
Mhm.
And that, all we did was stop doing that. you know but there is no magic sentence for it. It is always, I think, the most helpful thing to do is to bring it back to, this is what's causing this. I'm not choosing to go, I'm accepting what came, right? But I've never seen anybody successfully like fully navigate it, because it just is, you want to make sure you're doing it right. And Catholicism in particular, I think I just have more experience with, being born and raised that way myself and having family that are Catholic. It is that there's certain things, you got boxes need to be checked and they're not gray, and it's just, you don't want to misstep and do it wrong. And the last thing you want is someone you love to misstep and do it wrong and worry about where their soul goes afterward. um
Talk about stress that
mhm,
you're adding to yourself,
mhm,
about death, which is out of your control. Your body's going to do it one way or another
mhm.
anyway. So to take on responsibility for someone else's death
Yeah.
and or their soul based on what your belief is, but you don't fully know
You
necessarily.
just fully set aside what actually is happening. That's
Mhm.
the baffling thing to me every time. It's like, I'm going to pretend cancer's not here. I'm going to pretend they're not 90 with Alzheimer's and haven't known who they are in 10 years. I must do everything to keep that life living. It's like, are you not like circumventing the will of life? Like, this life is trying to die and you are saying, I say no.
Exactly.
It never
That's
has that.
terrifying, by the way. That
Yeah.
is super terrifying that if you have dementia and Alzheimer's,
Mm.
which I've had people in my life with both,
Mhm, mhm,
when you are no longer capable
mhm.
speaking up for yourself, to have everyone around you because they can't let go or they think they're doing the right thing for you, when those two diseases are progressing the inevitable. Please don't, like, if I'm going through that, please don't hold on to me. Please let me go. That would be a torture amongst tortures.
This
Like,
needs to be a whole episode, right? Because we can do so much to take care of a body, and we can do almost nothing to stop the progression in your mind. And we have become a culture of all these perfectly preserved bodies with minds that have gone, because we're intervening. They're going to the podiatrist, the pulmonologist, the cardiologist, and they don't know their name. But we are maintaining that body to perfection. And I've never met somebody who was the person arranging those things who doesn't say on some level, either outright of like, God, this can never be me, or in like basically alludes to the same thing, whether they say it out loud, but are just trapped in our healthcare system sets them up.
mhm.
Intervention, intervention, intervention. got to do this. And every time you go to the doctor, what do you get? The next appointment scheduled. So how do you, as a person who loves a person, stop going? So, and especially like if they have heart disease and they say, I'm not going anymore, that's best case scenario. What happens when they have dementia and they're just going? How do you get out of that loop without outwardly saying, I'm going to stop taking care of them?
Well, I know the answer to this, but I'm going to voice it anyway. Doctors who can
Mhm.
see what's happening, and they're allowing this enabling of, well, we're going to protect the body, we're going to keep going with this, but they
Fix that
already
heart rate.
know that it's part of the death process.
Mhm.
Why aren't you having the actual conversation? I mean, this is the whole reason we're doing these episodes, right? Why aren't you having the conversation with their loved ones
Yeah.
of, this is the first stage, this is normal,
Mhm.
now here are your options
Yeah.
based on
For
this?
some, but they're the minority.
I, I have
You know,
not yet
I can't
encountered one.
even count how many people I have met fully living in memory care, and been there for the whole process and have new pacemakers, new, like new stents placed from cardiology. And I'm like, if that were me, I would be so sad, but at the same time, if that were me and I didn't know what I know whose job it was, and the doctor was saying she needs a pacemaker, the doctor was saying, come back in 6 weeks and we'll look at this again. What do I know? Right, like, and I think that's the thing that doesn't get said often, whether it's dementia or cancer or anything. We don't do a good job as a society looking at each other and saying, please don't do that to me. And it's okay. And let me tell you why. Because everybody immediately goes, ooh, we won't talk about that. And in healthcare, the system is designed to not give you time as a doctor
Mhm.
and to really numb you to noticing. Because they walk in and, we're a culture of specialists, right? I'm not here to treat your dementia. I'm here to check that heart rhythm and it's wrong and I can
Exactly.
fix it. I'm not here to treat your dementia. I'm here to treat your pulmonary function and it's wrong and I can fix it. I'm not here to treat your dementia. I'm here to treat your nutrition and it's wrong. So here's your insure. Let's make sure your body looks like a 50-year-old's while your mind just continues to slide. A whole nother episode.
Absolutely. And just a quick little story to kind of think bring us to a close, at least on this topic. My ex-husband's grandmother.
Mhm,
So I was a teenager when she had Alzheimer's. And
mhm.
then I saw, and the whole family like experience, she did go into a facility where she was cared for. And the family did everything they could to make sure she had the health care that she needed, meaning they couldn't be the round the clock nurses and doctors
Such a hard.
for her. This was
Mhm,
the right place for her, and they made it homey feeling for her, to with pictures and everything. But she no longer remembered her life. There was no short-term memory. Like, as her disease progressed,
yeah,
she was very frail at this point, like her body was letting go as well.
yeah.
But she had a wedding picture up, and eventually she forgot everybody, like, who
Mhm,
was there. She didn't recognize her family members anymore, but the
mhm.
one thing that she remembered
Yeah.
was that she was married,
Yep.
and she thought that her husband abandoned her in this facility,
Oof.
left her there. And
Mhm,
she didn't remember children, grandchildren, anything towards the end of her life, but she thought her husband abandoned her. And the
mhm,
truth is, her husband had died decades before. She raised her children
mhm.
like on her own. I mean, the youngest was a teenager at this point, but still.
Yeah.
So she had no memory of
Mhm.
this.
Yeah.
So to my family,
Yeah.
I mean, we're going to use this for posterity anyway, but to my family, if you torture me that way, I will come back and haunt you.
You will be
And
the
that,
first
I think,
one
is the
I
perfect segue to what will
yeah.
be like the next phase of this conversation, which is what happens to your
How
soul,
do you
your
haunt someone?
spirit.
I would like that note. I would like that info because I've been
I will
threatening it, but
share. Oh,
okay.
I'll share my dad's story of what he did to me. Anywho, let's come back in a minute and we'll talk about what happens during death and after death, like with your soul.
Mm.